Okay, so next topic we're going to cover today is carpal tunnel syndrome. Very common for a variety of reasons. Most common in pregnant women and in the over 50s, funnily enough. There's a few reasons for that, but I'll explain about what exactly the carpal tunnel is, because many people don't know. If you imagine a plug that you plug into a socket in the wall, and you unscrew it, you take off the back. Inside the socket you would have a little tunnel where the electric cables ran through. This is exactly what the carpal tunnel looks like. The tendons and the nerves, the blood vessels all coming down the front of the forearm, narrow into a very small channel between the two bones of the forearm, the radius and the ulna. There's a small gap in here and everything gets crammed in. Now you can imagine, as you're using your arm, if there wasn't something securing these vessels and tendons and nerves in place, everything would just pop out. So there's a band of tissue which runs across the wrist and keeps everything in, and this forms the carpal tunnel. Now, as you can imagine, because everything's held down here, there's going to be a little bit of friction as you're moving your arm and the blood's flowing through, which can build up quite a bit of tension. And again, in relation to tennis elbow, one of the main causes of that condition was repetitive strain, and this is highly linked into carpal tunnel also. So if you use your wrist or arm within a very specific angle over and over and over again, you can build up a little bit of swelling in the tendons, and this can create pressure in this area here, which is called a carpal tunnel, and this pressure then starts to set up a loop of tension, and the tension gets bigger and everything gets tighter and it gets more swollen, and every time you move your wrist or hand it creates pain, and the pain creates tension, and you're stuck in a vicious cycle of pain and chronic inflammation. Very hard to get rid of, especially if you keep on doing the same movements that caused it in the first place. As I said before, there's quite a lot of vessels run through this area, blood vessels especially, and in pregnant women it's quite a common condition because the hormone changes, and these hormone changes can create changes within soft tissue, within blood flow, within nerve supply, and can create a bit more fluid around the extremities, especially around about the wrist in this area. And so a lot of pregnant women at certain stages will get carpal tunnel symptoms. Generally these wear off once they've given birth, so it's generally nothing to worry about unless there's a history of chronic carpal tunnel syndrome. So once you've given birth, generally the symptoms will go as the hormones return back to normal levels. Again, there's a link in with the neck. Nerves being pinched in the neck can create referred symptoms anywhere down the arm, and these can range from very sharp shooting pain, burning, tingling, stinging. I've had patients describe spiders running up down their arms, hot and cold water, also numbness, pins and needles and tingling, and this can come anywhere in the arm. One of the common places is round about the wrist and into the hand. And linked into carpal tunnel are changes in the sensation in the hand as well. So you have a feeling of swelling, you can have numbness in certain areas of the hand, loss of sensation, a loss of muscle power, numbness and tingling. All or any of these symptoms can occur. As regards treatment, ice can be very effective in reducing the swelling. Quite often your doctor will give you a course of anti-inflammatories, and again you can help this with your diet by having an alkaline diet and including some strong natural anti-inflammatories such as pineapple and turmeric, which can help in the whole body to reduce inflammation. But icing over the area needs to be for at least 20 minutes. You can wrap any ice in a damp towel, and that prevents burning of the skin, but it's also going to transfer the cold straight into the tissues. It needs to be at least 20 minutes to have any long-term effect. You'd want to do that 2 or 3 times a day if you're able to. Again, changing your day-to-day habits. If there's a link in with a repetitive strain due to your work or some hobby that you do, you'd want to change things, allow the tissues to rest for the healing process to move forward. The healing process for every type of tissue is exactly the same. It goes through the same stages, just the different types of tissue heal at different times. So muscle is a very fast healing time because of a very big blood flow, gets lots of nutrition. Soft tissue such as ligament, cartilage and tendon, slightly less because of less blood flow, and nerves are the longest of all. They heal about 1 millimetre a month. So you can see that's going to be a very slow healing process, so don't expect fast results. So perseverance, patience, reduce inflammation and change your lifestyle to accommodate the problem.